What are some of the major side effects of treatment that patients should be prepared for?
CLL typically is a disease of B cells, and a CLL B cell is one which is not functional. And at the same time, the treatments that we use can affect all B cells, and that's one of the reasons that they are very high likelihood infections, both because of the disease and because of the treatment. Um, Second is bleeding of different types. It can affect the heart. Sometimes some of these diseases can affect. Some of this treatment can also cause the GI issues and liver issues and so on. So they have to be monitored.
In 2023, there are many treatment options for CLL. The field has rapidly changed, and so we rarely ever use chemotherapy. It's really reserved for select patients. And so there's kind of two main classes of treatment options. So I'll talk about the side effects for those kind of classes of treatment in general. One of the major uh, really advances for CLL and other related B cell malignancies have been BTK or Bruton's tyrosine kinase inhibitors. These are drugs like ibrutinib, acalabrutinib, zanubrutinib that are FDA approved for CLL, both as first treatment and also for CLL if you haven't had this drug in the relapse setting after other prior treatment. So, this class of drugs is a pill-based treatment. As a class, there's a little bit of differences between the different drugs, between ibrutinib, acalabrutinib, and zanubrutinib, but they do share some commonalities in the overall side effects. So one of the major things we see with really as side effects with all CLL treatments is these treatments do have the ability to decrease the blood counts, sometimes often before they get better. And so you might have lower hemoglobin, lower platelets, in some cases, lower white blood cell count. However, actually, with the BTK inhibitors, these drugs, often when a patient first starts the drug, we actually see the white blood cell count go up even further. That's something called a lymphocytosis, or the lymphocyte count increases, because interestingly, the CLL drug works by, you can think you have CLL cells and lymph nodes. It's working, it's actually releasing some of the CLL cells from the lymph nodes and pushing them out into the blood compartment. So I always tell patients to expect that, but right after they start the BTK inhibitors. And it's not that that the treatment's not working, but really an expected byproduct of starting the drug. The other major side effects that we can see are there is an increased risk of bleeding with these drugs. And so, for patients who are on a blood thinner already, we have a discussion about the safety of that, whether it makes sense for the patient to do this or another treatment option. But there are patients that can safely do both. And then if patients are scheduled for procedures, say there's, a skin cancer that needs to be removed or some other type of dental work or some other type of operation, patients often will need to hold the drug for a period before and after the procedure. So it's really important to talk to your doctor and let them know that procedure is happening. The other thing that we've seen with BTK inhibitors is that they can have cardiovascular side effects, and so they can increase the blood pressure. So that's something that we very carefully monitor at our visits. And often for patients with pre-existing heart issues or hypertension, high blood pressure, I'll actually have a discussion with the cardiologist or primary care physician before they actually start the drug to make sure that we have a good plan should we encounter higher blood pressure. And then the other risk we talk a lot about is the risk for a heart arrhythmia or atrial fibrillation. This is an abnormal heartbeat. It's common in the general population, but we actually do see a higher rate in patients who take ibrutinib, acalabrutinib, or zanubrutinib. There's some differences between each drug, and sometimes we select the drug based on the patient there. It does look like ibrutinib, this risk is higher, we know now, than with acalabrutinib or zanubrutinib. And so again, for patients who have a history of AFib or other heart condition, I really usually do a cardiac evaluation before and work with a cardiologist to make sure that we have a safe plan going into starting the treatment.
Is there anything patients can do to lessen or better manage these side effects?
Most patients actually, while there's a host of side effects that come up, I would say, in general, patients tolerate the side effects really well. I think it's always a good idea to talk to your doctor and the healthcare team, the nurses, nurse practitioners, pharmacists, if available, to kind of know what the side effects are and just have a plan to, call your doctor if they come up. But I will say, actually, many patients start the drug and don't have any side effects. And some of these side effects, like the high blood pressure, can be cumulative over time, but some of the other side effects, for example, acalabrutinib, many times patients will get a headache in the first few weeks of taking the drug. It responds well to Tylenol, caffeine, and then it often goes away. Really, again, staying attuned to the side effects, but you might, as a patient, start the drug and not experience any side effect. And these are pill-based medicines that patients are able to take, once or twice a day, depending on which one is selected for you, but often tolerated very, very well.
Additional steps you should take to limit side effects.
Follow up, fundamentally important. They should be vaccinated appropriately. Flu and COVID every year. For example, following the recommendations for pneumonia vaccines are very important. And then, of course, trying to avoid sources of infection. Those can definitely help. Sometimes patients are treated with something like rituximab. It's a rather simple drug. And in those cases, they're trying to really decrease the clones of CLL, the cells of CLL, so that those bad effects of CLL are not occurring. Um, in those cases, you're really depleting not just the CLL, but also other B cells, and those are an important subset of immune cells which can fight infections. So as a result, you are more susceptible to infections. The other toxic effects, for example, there are some small molecules, colibrutinib, and that family, for example, they're very effective in treating CLL. They can control the disease very well, but they have untoward side effects which are not related directly to CLL, but to bleeding. And patients have to be aware of those. Some of the drugs can also have toxicities related to food intake, and taking it in relation to food can decrease or increase toxicities. Um, those are typically minor, but yeah, depending on the drug, the infections are obviously the commonest one. By themselves, CLL itself can cause infections or more risk of infections. Some of these treatments can also increase the likelihood of infections and bleeding, as with ibrutinib. The more involved multi-drug chemotherapies have standard chemotherapy side effects, peripheral neuropathies, infections, again, sometimes diarrhea and vomiting. Some of the drugs that are used for treating CLL can also cause diarrhea, and that has to be, again, discussed with the oncologist whether dose modifications are warranted.